Hello, this is meant to be a review of TeamSTEPPS for individuals who have gone through the TeamSTEPPS training. The purpose of this video is to review some of the basic concepts of TeamSTEPPS with you and get you to start thinking about how you can apply this to your clinical courses and your actual care of patients. So we're going to fly through a lot of the concepts because you've had these before and you've learned about these before. But let's go ahead and get started with this. So if you remember TeamSTEPPS, this is a leadership model. This is a patient safety model. It's based around 4 teachable skills: leadership, communication, situation monitoring, and mutual support. And the idea is that these 4 skills facilitate a good team. And through these good teams, that means the team has knowledge of each other's roles and responsibilities and how to support the team. They have a good attitude. This is a team that trusts each other, they orient each other, they focus on each other's needs, and they put the patient first. And then performance. All of this leads to top performance and patient safety. So the team is adaptable, they're productive in what they do, they're efficient, and most importantly, safe. And again, we do all this to improve patient safety outcomes. Some people will look at this training and say, this is common sense stuff, right? We need to communicate, we need to be good team members. And that's true, this is common sense. However, the reality of healthcare and the reality of team performance is that we don't always demonstrate these skills, and patients suffer through this. So what this means is we need to review this information, and most importantly, we need to apply this information. So it's important that we're discussing this and reflecting on this material. One other point about this is that TeamSTEPPS is built on the concept that the team members have the basic clinical and technical proficiencies. So I can be a great team member, but if I don't have the basic skills of a physical therapist or an occupational therapist, patient safety is not going to work. Teamwork is not going to work. You have to have those basic skills. This should be something that looks familiar to you. If you look at the barriers on the left-hand side, these are all the things that inhibit a good team and can negatively impact outcomes and patient safety. We're going to review all the tools and strategy in the middle bar, the tools and strategy yellow bar, and then this all leads to the green bar, the outcomes that we're looking for. Why at St. Ambrose? Why are you learning this as a St. Ambrose student? Well, these are skills that are vital in clinical practice. You will see these skills used in your clinical sites and at large organizations and small organizations. This is a tool that's been around since the 1990s and has been developed and grown, and it's used either as a whole tool or parts of the tool are used throughout healthcare systems everywhere. The nice thing is this is the common language. This is the model that we can orient ourselves around in the College of Health and Human Services. It's evidence-based. There's good support for this. And this is something that we've all committed to in our college to try to apply in our interprofessional days and when we interact with each other throughout the college. Let's start off with teamwork. Okay, so this pyramid should look familiar to you. And as you notice, the patient or the person is at the top of the team. They're the most important person in this whole model. A team is when 2 or more people are working together, they have a specific goal, and they're moving forward with this. Our core team, those are the providers that we think about. This is the healthcare providers typically. A contingency team, these are individuals who might step up and provide care or interventions in a very short-term, immediate time period. In the medical model, we most routinely think about this in a code team or emergency response team. But a contingency team could be, a group of therapists, a group of nurses pulled together to quickly deal with a discharge. It could be someone dealing with a medical emergency that happens on a rehab floor. The coordinating team, these are people who are responsible for managing the core team, making sure everything works that way. The ancillary support team, these are the housekeepers, these are the security teams, these are the IT support. These are the people who keep the facility running, who aren't always recognized but are so essential to the team. And then the administration, they're responsible for setting the overall mission, vision of the organization and holding the teams accountable and providing that supervision and defining the culture of the organization.
Now we'll move on to talking about leadership. There are people who are leaders, so the designated leaders are always in charge of the team from a more administrative or more of a assigned role. But then there's also situational leadership. This is the individuals who step up when there's something going on. This could be emergency situation, or this could be you're doing a co-treat or leading a team discussion. That person steps up and leads in that situation. The leader is responsible for saying what's going to happen. They're defining the plan. They're also responsible for conflict resolution. Every team has their ups and downs, and they need to be aware of these conflicts, out front in these conflicts, and addressing them. There's different tools that we have to address a good team. We'll talk about some of those. A brief. Briefs are held at the beginning of the day or the beginning of a situation where you say, as a team, this is what we're going to do. We're going to assign the roles, let's talk about goals, and maybe any immediate concerns for that day. That, Mrs. Rodriguez, she's going to be discharged today. We need to know what she's going to do. Your colleague in nursing is sick, so they're short on the floor. So we need to be aware of those things. So it's meant to be kind of the planning session for the day or for the unit of time that you're discussing. Topics, this is a typical checklist. I won't read it word for word for you, but these are the type of things that might be considered during a briefing. A huddle, this is when maybe something happened or something needs to be addressed right away. Maybe there's a situation where you're working with a patient and a transfer did not go well and the patient fell. It could be nursing comes to you and tells you there's been a change in the day. You need to come together and figure this out. It could be that a colleague calls in sick and you and your clinic, you have to rearrange the schedule. How do you do that? And it's in a way to bring people together, and it can be to reorient. It can be to express concerns. It can be to discuss the plans that may be happening from that point forward. Then a debriefing. This can take place afterwards, and this is great when you have team members who have not worked together in a long while, or they're new to each other, or when you have been in a complex situation. It's a way to take some time and say what went well, what didn't go well. When this happens, it's important that everyone's open to discussing and learning and sharing. Some people may be made to feel uncomfortable because their actions may be called out. It's important that we center this around what's important: patient safety and our outcomes. It's not about assigning blame that it was Mike's fault or someone else's fault. It's about saying, as a team, this is what we did well on, and this is what we could have done better on. And again, you have checklists, and in your organization, you might have a process that you use for a checklist, or you may be asked to create a checklist, but there should be a process that you go through when you go through the debriefing process. The next part of the TeamSTEPPS skills are communication. So this is the process in which we share information back and forth. It's not just sharing it, it's also receiving the information. We have various tools that we'll talk about in a minute, but the key thing with communication is that it's clear, it's complete. We tell information, we keep it brief and to the point, and it's timely. We want to give the feedback right away or as soon as possible when we do this. One common tool that is used is something called SBAR. It's a framework that we can communicate from one professional to the other. We go through, we share the situation of what's going on, the background, everything we know about the patient, our assessment. The A can be a hard thing to do, especially when we're talking to maybe the physician or the nurse practitioner, the person who maybe diagnosed the patient, and we feel like, are we in the place to give an assessment or a diagnosis? And I would say, yes, we are. The goal of this is to give our assessment of the current problem. That's really what we're focused on. And any kind of recommendation. Do we feel like the patient needs to be seen again by the physician? Do we feel like the patient needs a diagnostic test done? Do we feel like we just need more guidance from the physician or the other healthcare provider? Another commonly used tool is a call out. This is when it's important to give key information. This ties in a lot when a code situation or emergency situation, a surgical situation, but there are situations where in rehab where we might use this. This could be during a transfer of a patient who's on a mechanical ventilator. You're going to tell the whole team that we're going to do it this way. or if a patient needs to be suctioned in the intensive care unit, it's important that everyone knows what you're going to be doing and why you're going to be doing this. Or if a patient needs to sit down because their vitals are changing and they need to rest, this can be an example of using a call out. A check back, this is a way to verify what has been said. So maybe you're on the phone and a physician tells you that the patient's weight bearing status is now weight bearing is tolerated. You say, okay, so what you're ordering is that this patient's weight bearing status is now to weight bearing is tolerated. Yes, you can change it from weight bearing is tolerated. And you think that's a little thing, but that can be a big thing if a person's fracture's healing. We want to make sure that we're getting the weight bearing status right at that point. A handoff, this happens a lot in rehab if you think about it. PT to OT, there might be different professionals. Patient status can change on a daily basis. So giving the handoff or the new therapist taking over this information that today Sally worked on this, we did this, she responded in this way. It's not in the chart, but the doctor did increase the pain medication, or maybe it's not previous notes hasn't documented this, but it's important for you to know this piece of information. So it's a way to hand off this information to make sure things clearly go from one professional to the next. Our next area we'll talk about is situation monitoring. This is the point at which we're really observant about what's going on our team and in the setting that we're at. And this is key because if we have situation monitoring, we can give our colleagues the support that they need to be successful. And situation monitoring, this is a continuous process where the actual monitoring themselves is an individual skill that we have. And then we have awareness. So monitoring is watching it, awareness is what's actually going on. And then it moves us to a shared mental model where we can support the team and get a team outcome. So it starts with the individual skill, then it leads to what we do with that information, and then it leads to a team outcome. One way to do this is the STEP process. We look at the status of the patient, we look at the status of our team members, we consider the environment that we're in and how we're moving forward. And it's not just looking at the patient, it's not just the team member, it's all these things put together. And these things are not just the responsibility of one team member, it's a responsibility of the whole team to think about these things. When we walk by and a patient's struggling, we need to think about how that is impacting the situation, is impacting the patient. When the nurse is in a difficult situation, we need to think about how that's making him or her feel. When our physical therapist assistant or certified occupational therapy assistant is struggling to get his or her work done, how's the environment affecting that? How can we help that? Situation awareness, again, this is being aware of all these things that are going on. So knowing the current condition and how it's affecting one's work is important. And that leads to that shared mental model where as a team, we're all on the same page. We have an understanding of the situation, what's going on, and that's shared across the team. How do we share that information? Well, as we learned earlier, we do that through briefs, huddles, debriefing, when we do it and how we do it through SBAR, call outs, checkbacks. These are all ways that we do that. Why do they help? Having a shared mental model gets us all on the same page. It helps us check each other and back each other up. We understand who is doing what, and it creates a commonality of purpose and effort. So it makes sure we're all keeping in mind that Mrs. Jones wants to get home. That's her focus. How do we get her home? Our young athlete needs to get back to playing volleyball. How do we help her get back to doing that? We understand how this all works together. Mutual support. This is where we help each other out. This is a team member's role, and it's also enhanced by the leader. It ties back to leadership. Is the leader creating an environment where it's okay to step out of your maybe assigned role to help that other person out? Are you people like that being recognized and rewarded? Are we aware of that and encouraging each other to do that? Okay, so that's going to be mutual support. What does it mean? It means we assist each other. We provide feedback, and we advocate when there's an issue. So that means when a person seems like they're overwhelmed with work, can we step in and help them? Um, do we give feedback when it's necessary? Do we give somebody, say, hey, you did a great job with that? Or, what are you doing right now? What's your goal? What can I do to help you? And then when it's a patient safety thing, maybe that therapist is going to um, try to walk a patient without oxygen. Maybe you're aware of a patient's knee restrictions, weight bearing restrictions, range of motion restrictions, and you watch a colleague put that patient in a difficult situation that might threaten their safety. Do you feel okay to step up and address that with your colleagues? Type of feedback. This can be formal, like in a debriefing, in a huddle, that sort of thing, or it can be in an ongoing process where it just comes up in real time there. So, maybe the better example of the formal would be a performance review, a case conference, a hearing, a meeting that way. And the huddles and debriefing can be more facilitatory of the informal feedback. How do we advocate and assert for a patient? We need to be polite. We need to be supportive, but there are times we need to step up and challenge our coworkers and our colleagues. But this needs to be done in a firm way, especially when patient safety is a concern, and it also needs to be done in a respectful way. It's important that when we're in this situation, we have the comfortness, or that we feel comfortable being assertive in this situation. So we clearly need to say what our concerns are, but also have a suggestion or a solution. We want it to be non-threatening and not after the person, but the process. Open the discussion. Hey, I see you're working on Bob's shoulder. I'm a little concerned because yesterday the doctor called up and said we shouldn't be taking his arm past 90 degrees in that motion. It looks like you're doing that. I'm at a bad angle. I'm not sure or not if you are actually doing that, but I'm a little concerned about that. Um, can I help you with your motion, or would you like me to help you measure that motion so we're keeping Bob's shoulder safe? Does that sound like a plan? Something along that lines might be. Or it could be you're working with a different professional and you see them trying to walk a patient who maybe needs a little bit more supervision, needs a little bit more of assistance, and they're not safely walking that patient. Or you're a speech language pathologist and you see someone trying to give someone water who shouldn't be doing it in that manner. You give them a solution, you help guide them in that way. Now, sometimes people will take that feedback and they'll say, "Oh, thank you," and it'll be, well received. However, there'll be other times when it may not come through, and then we need to be a little bit more assertive. A two-challenge rule is to at least try 2 times to be this way. So that maybe the therapist will say, "I'm fine doing this. I've walked this patient in this way before. I should be fine." Um, you should repeat your concern again. I'm concerned with how you're walking that patient because of their leg weakness and their very low endurance. I'm concerned this patient may fall if we're not following with a wheelchair. Okay. And then we can also stop the line. We can say, okay, we need to stop right now and we need to reassess what's going on here. And this comes down to stopping the line when you think about an assembly line, when there's a danger on the assembly line. But what we do in healthcare can be just as dangerous too. So we need to use this wisely, though. We shouldn't be stopping the line every day. If we are, there's another process that needs to be looked at, the overall process of how we're managing and working together. This should be a once in a while thing and should be used conservatively, but we should feel the ability to use it when we have to use it. Another way you can do is using cuss words. Being very clear when saying, I'm concerned because of this, I'm uncomfortable for this reason, and this is a safety issue. I'm concerned that you're asking me to mobilize this patient who has a blood clot. I'm uncomfortable because the patient is not yet on the proper medications to decrease her risk of having a pulmonary embolism, and I consider this a safety issue. Okay, so this wouldn't be the first conversation I would have, but if someone was asking me to mobilize this patient and they weren't yet on anticoagulation, and I said it twice, I meant then move on to using cuss words. There are sometimes conflicts in teams. There's informational conflicts where we just have a disagreement on the actual situation. And then there's also interpersonal conflicts. And these typically tend to be um, things that have been brewing for a while. It could be there's previous interactions and it's leading to the conflict now. One way to do this is using the DESC script. Again, having a structured way of doing this where you describe it, you express your concerns, what are the alternatives, and if they don't change, what are the consequences of us not doing this? And ultimately, again, it comes down to the consequences of patient safety and poor outcomes. That's where we need to bring it back to. So this represents your 15-minute review of TeamSTEPPS. So let's think about why we learn this and how we apply this as healthcare providers. Hopefully this tool helps us feel confident in leading. We don't always have to wait for the person who has the title of supervisor or physician or team leader to do it. There are times that we need to step in. We could be a first-year employee, we could be our first week on the job, and we may be asked to step in. We may be thrown in a new situation in a new clinic that we haven't worked in, and we need to step in. Team meetings. We've all been in meetings that go on and on and on. If we follow a format of how we give feedback, how we receive feedback, how we communicate, this leads to faster team meetings and gets us back to the reason we're there, patient care. No matter your position, you will be supervising staff and you'll be working in an interprofessional team. So by using these tools and having everyone on board, we'll be better prepared to communicate with our colleagues, better able to guide our support staff too. Um, we learn through our mistakes. We learn through trial and error. So using TeamSTEPPS, we have the tools to go back and review what we've been doing, talking through what we've done, finding out what worked and what didn't work. TeamSTEPPS also gives us a way to raise a concern with a colleague instead of just saying what you did was wrong. If we follow the format of going through and stating the concern, why it's a concern, we share a suggestion and we move forward with the solution, that's going to be much better perceived. And additionally, when that model is followed throughout the team, throughout the healthcare system, someone will recognize that, okay, that person is giving me a concern using that model. I need to listen. We can use TeamSTEPPS to help mentor somebody along. And we can also use TeamSTEPPS to help support each other so we're moving forward with that shared mental model. So again, this is the slide you saw at the beginning. All these barriers are the things that are keeping us from patient safety and good outcomes. And you can look through all these things here. And most of these things can be solved through some of the TeamSTEPPS strategy. Okay. And again, the foundation of this is that you have good clinical skills. You have the competencies you need to be the healthcare provider you're licensed to be. But using these tools and strategies can help address a lot of these barriers that we face in the healthcare system. And again, what does this lead to? It leads to a shared mental model where we understand each other. We have an adaptable team that can move around. We have a team that supports each other. We trust our team members. It leads to great team performance and ultimately resident safety or patient safety. So this brings to conclusion this TeamSTEPPS review. Please be looking for ways to use this. There will be some explicit ways where we tell you this is actually TeamSTEPPS that we're using right now. And there'll be other situations where you'll say, you know what would be helpful if I shared my concern in this manner, or if we need to do a debriefing right now. We may not actually say this is TeamSTEPPS, but there will be situations for you to use TeamSTEPPS.